give the session.
It's all right. I can get you well, Katile.
Yeah, we are waiting to connect to be live on air.
Yes, immediately that one is done, we are going to start.
Yeah.
Very well, the meeting has started. Good evening, everyone present from this point. Starting, I am Mr. Maurice Omondi Onditi.
Mr. Maurice.
Yes, Katile.
Yeah, we are not yet live. Yeah, you can begin. You can begin.
Good, huh? Katile, on my end, it is an indication that we are already live and we are starting this meeting. Now, first, it is an indication. I'm happy to be here today. Yes, ladies and gentlemen, I'm happy to be here today. I'm going to be your moderator this day, and I take this first opportunity to welcome you to this meeting. It is a common saying that health is wealth, and no amount of wealth is greater than health. For that reason, I want to thank the Youth Barrier Breakers Africa for coming up with such a wonderful organization. Now, today we are going to talk about COVID-19. COVID-19, the pandemic that has thrown the whole world off the balance. We are all aware, and everything is perfect in place. And we are going to get the talk from two wonderful people. I'm going to start with Madam Martha. Martha Oguna is the Mombasa County Research Coordinator for COVID-19 study. Madam Martha, I can see you are there looking as wonderful as ever to share with us what it all entails. Youth comes but once in a lifetime. Now, that's what Joe Elvis once said, that you are only young once, and if you work it right, then that once is enough. COVID-19 is here with us, and we need to know what we should do, how we have to go about it, and the nugget of wisdom is with you. Madam Martha is the County Research Coordinator for COVID-19, Mombasa County. We are going to start with her, then we'll be followed by one Mr. Tsitati George. Madam Martha, welcome.
Thank you so much, Mr. Maurice. Thank you so much, Katile, for this opportunity. It's a pleasure to join all of you to talk about this very nice topic that we need just to understand just a little bit of what it entails. Thank you so much, Maurice, also for the great introduction. So I'm going just to begin. I hope I'm able to share my screen. So we are all able to see this.
Yes.
Okay, thank you. So as I said, we want just to learn a little bit about COVID-19 and how to prevent and manage it as a youth. So we need just to get an idea of what COVID-19 is. COVID-19 was first discovered in China in a state called Wuhan, and it is an RNA virus of the corona family first discovered, which means it's a novel in 2019, hence the name COVID-19. So it's a SARS-CoV-2, which is a severe acute respiratory syndrome. Then we need to know how it's transmitted. As we can see, it's transmitted through coughing, through sneezing, through talking, through touching contaminated surfaces, and through intubation, especially for the health workers in the hospitals. So this is just a view of the structure of how COVID-19 I mean, the coronavirus disease that looks like in the microscopic view. So how does it affect? Now, COVID-19 affects the upper airways, which is the nose, the pharynx, which is the back of the throat. And as we notice, that's the reason why whenever we are having the test, it's usually through the nose and through the back of the throat. Then after it affects these two, it descends to the lower airways, which is the trachea, bronchi, and the air sacs, which are the alveoli. So when we have all these is when now it gives us the symptoms and signs. So which are the signs? Mostly it's cough, fever, sore throat, sneezing, flu, chest pain, difficulty in breathing, weakness of the body, loss of smell, and loss of taste. Now, please note that the signs and symptoms may vary from one person to the other. And these symptoms, you may not get everything. I have experience of a person who did not have all these apart from just the sore throat. And eventually when they started losing smell, I mean, the loss of smell and taste is when they went and tested and they were tested positive. So it's not necessarily that you have to have all these, in as much as sometimes you're told that when we see like when we go to the supermarkets, I mean, the fever is taken and all that. There are some people who completely do not have fever or even sneezing or even the flu. So we have to just check in all of these to make sure that whenever you feel the signs and symptoms, then you should be able to go and visit a health center. So the people who are mostly affected are the elderly, the people who have heart disease, diabetes mellitus, the renal disease, cancer, TB, and HIV. These are some of the things that we call the comorbidities, meaning that when you have other chronic illnesses, they actually make you susceptible now to have very now accelerated signs, and even just the disease now becomes more severe. So we have to know that death occurs due to shock and respiratory failure. So the disease, we have noted that it runs a course of 14 days. That's why we realize that when you're taken to quarantine, you're given at least 14 days, because within that time, you'll have either recovered or at least gotten medical help. So this also depends really on the comorbidities and the severity of the illnesses. So what is the treatment of COVID-19? We all know that currently we do not have any specific treatment. We only manage the symptoms. So like, for example, if you have fever, we manage it with antibiotics like Panadols, those fever, whatever, Calpol, for the children and all that. So for the virus, we have the antiretroviral, but please note that this is still on trial and we've not yet gotten really way forward on that. So we have also steroids, we have anti-inflammatory, depending on how you present your illnesses. So antibiotics for infections, especially pneumonia, and probably like I would give you an example of the same lady that I told you that was unwell and presented with sore throat, was given only antibiotic and really got well and and just was quarantined. So others is oxygen, and definitely by the time you're reaching the level of oxygen, you're now in hospital and admitted to be given oxygen, respirators, and the IV fluid. I don't know whether we have anyone with question up to there, or I can continue. Then maybe we can cumulatively ask questions. So the silence means that I can go on.
Yes, you can continue, madam.
Thank you, Maurice. So what is the prevention? Prevention is wearing appropriate mask properly. What do I mean? When you wear appropriate mask, it means that most of these masks that I'm seeing around are actually dust masks. and not the mask that can actually, cover you properly from the aerosols. So you have to wear appropriate mask and you have to wear it properly. Quite a number of people I'm seeing around are wearing their mask at the chin. And so that does not cover you. Or I can see people covering only their mouth and not their nose. And also most of these cloth, whatever, masks do not cover the area of the nose properly. So it leaves quite a gap for the aerosols to go in. So we have social distancing. This means that at least 1.5 meters apart. This is just to avoid contact with each other. So that, because you're told that you can only trust yourself, you don't know how about the other person. The other way of preventing is by washing hands with soap and water and also sanitizer. Avoid contact with suspicious surfaces. For example, the most public places, I would call them like suspicious surfaces. Like for example, supermarkets, hospitals, churches, public transport. So you have to be very careful. Whenever you have contact in these surfaces, avoid touching your face. So you must also have adequate ventilation. And of course, for the ones who have tested positive, they are taken to quarantine centers. But nowadays, of course, the government have eased this, and you can even quarantine from your house. Then we have one of the prevention measures is adequate and reliable contact tracing and testing. But currently, we know that it has really spread to the community level, such that now contact tracing has not been that easy, though it's still ongoing. So who are the people and areas at risk of contracting COVID-19? When COVID came in, because we did not have much idea of what was going on, initially it was those who had traveled to countries with COVID. But right now, COVID has spread all over the world. The other people who are at risk are healthcare workers and their families. The healthcare worker, obviously, because of working in the first line of the treatment, and when they come home, of course, their families, they are more at risk of contracting it. Long distance drivers, of course, because of transversing from one area to the other, they are people who we can consider they are at risk of contracting COVID-19. So places really to avoid, as much as possible, avoid places like the stadium, the school, mosques, church, recreational centers, markets. These are people with large crowds. And so that means that the possibility of contracting this disease is higher in crowded places. So these are places that you should avoid as much as possible. So what have been the implications of COVID-19? Number one, we have the behavior change. So at least nowadays we can see we've really changed, especially now. We are very conscious in the way we wash hands, the way we interact, with the way we carry our day-to-day activities and lives. So we've seen so much behavior change. People who never used to wash hands as frequent as possible, we see that now they've changed. We never thought at one point that we needed sanitizers as part of our shopping list, but now we had to change and accustom to this new change. So there has been closure of schools, churches, mosques, and social places. Of course, now there has been a slow opening of the churches, but of course now they're still minimizing the numbers to make sure that there's not a lot of crowd. So the other implication was that there was restrictions of travel, movement within and without the country. We remember we had curfew, like for example, in Kenya, the ones who were in Kenya, we know that we had curfew, and the curfew still continues even right now. But at one point we had even restrictions of travel in terms of, I remember Mombasa, Nairobi, Kilifi, Kwale could not interact with other counties. So that was one of the implications now of the COVID-19. We saw curfew regulations of people to stay indoors at certain hours. The curfew in Kenya is still ongoing. We know now you can only be out up to 9 o'clock unless you're essential service provider. The other one is the way burials are conducted, the numbers, the weddings, the welfare meetings, religious gathering. We know that all these nowadays have been restricted, and we know that they have even been manned by police officers to ensure that there's law and order. The other implication, which is so evident, is mental issues. There has been a lot of fear, and especially the initial part, there was a lot of fear, there was a lot of worries, and there was stress. And especially because there are quite a number of people who even lost jobs. Now they are forced to stay at home. So there's a lot of stress levels on not knowing what next. The other one would be the psychosocial effects. There has been a lot of hostility. And hostility, what I mean is that we see that even couples who live together becoming hostile to each other, becoming hostile to their own children. There's a lot of depression. You were the breadwinner, you're no longer the breadwinner. So this has brought a lot of change in our lives. There's a lot of hopelessness, not knowing what tomorrow holds makes you not be able now to sit and think what's the way forward. And a lot of stigma, especially initially, like even now, anyone who has been suspected to have COVID-19, there's a lot of stigma about the way these people are treated by the community. So these are some of the psychosocial effects that are affecting a majority of the people. There has been the economic depression. So this is lack of basic necessities in the society, disruption of supply and demand chain. So we've seen a significant number of our youths losing jobs. And this has been attributed to COVID-19. We have seen that there has been disruption of the supply. There are people who were dependent on importing goods from abroad to sell. We can no longer do that. It's just recently that even just the second-hand clothes ban was opened up by the president in Kenya. So this has really brought up a lot of economic depression. The other thing is the increased burden to the healthcare. For example, the infrastructure. We know when COVID-19 happened, we did not have adequate infrastructure just to hold up the number of patients that we expected. And even the personnel. I mean, we didn't have enough personnel, equipment. At one point, we saw that we had to import some respirators and all that. This increased a whole burden to the healthcare because, number one, other diseases now became a bit of, shoved aside a bit, and this brought a lot of healthcare burden to the healthcare industry. So, what is the conclusion? We have to know that the virus affects most severely the elderly and those with comorbidities. As a young person, you know that you have better immune system and are unlikely to suffer. And in young persons, the body develops defense, but are likely to pass it on to the elderly and others with comorbidities. And these elderly and comorbidities, people with comorbidities are likely to develop very severe complications, which can lead easily to death. So young people, we have to be very careful, especially, I know as much as we want to, and probably will live with our own parents, we have to know that they are more susceptible than ourselves because our defense immune is higher than them. So as you know, I'm a research person, and the research has shown that young people are the leading asymptomatic carriers and most likely to transmit the virus. Hence, they must carry out their day-to-day activities with extra caution so as not to infect the others. In fact, it's mostly the young people who are said COVID haiko. And the reason being, yani, in loose translation, yani, there's no COVID. The non-belief of not having COVID is for the simple terms that quite a number of them, they are carriers, but they don't know, they are asymptomatic. you have the virus, but you have completely no symptom or any sign, and you actually just get well without knowing, but you're so likely to transmit it to other people. I will finish with a tweet from Fegildin, who is a scientist in Harvard Chan School of Public Health, and he said, the issue is that young people are likely 10 times more active and social than elderly and can infect 10 times the number of people, and especially if COVID-19 is mild and not noticed by young adults. So that's the picture of Mr. Fegildin. Thank you, Asante. If there's any question, kindly you can ask.
Wonderful, Madam Martha. It is great. Now, from this point, I've seen some questions. One, we had Vincent Kirungi, who asked the terminology, the term novel. Why do we have the word or the term novel for COVID? Maybe you can respond to that before I go to the next question by Ken Auma.
Just to answer in very simple terms, novel just means new. So it means COVID-19 is new. That's why it's novel. It has never been there. It's something totally new.
Thank you for that. Novel means new, unique, and what has not been there initially, out of normal. Number two, we have Ken Auma asking a question. Now that testing is not happening and the numbers seen as reducing, are we safe to open spaces?
One of the things we have to be careful is that we are likely to have a surge if we are not careful. So this is not something that we can just outrightly just wake up and the government opens up. And that's the reason why we have seen, especially let me speak of the government of Kenya and many other countries, is that they are opening in phases to make sure that we don't have a second surge of the COVID-19. And so we still cannot say that we've reached a point where we can open up the spaces.
Good. Thank you, Madam Martha, for that. I can see there are no more questions, but they will be falling one after the other. Our session still continues, and all those questions, kindly do not shy away from asking questions. If you have a question, you can raise your hand or you can type it in our chat box. We are there for you today, and everything has to be put where it belongs. That is wonderful. He who has health has hope, and he who has hope has everything. That is an Arabian proverb. Good, Madam Martha. I hope you are still with us because questions will still be coming. We are going to note them, and I know you are going to do justice to them. I'm learning as well.
I am still with you to the end.
Wonderful. Now, ladies and gentlemen, allow me to welcome the next speaker. The next speaker we have, but before we have the next speaker, there's just a question that has been asked. Maybe we can take that one, Madam Martha, before we move on. The question is, what happens to the public hospitals now that patients are not attending?
One of the things that I want to really encourage people is that we should not sit back at home just because you're sick for the fear of contracting COVID-19. Well, public hospitals are still very much operating, and we wouldn't say that patients aren't attending, only that we have low numbers. And what we are seeing more is people going to hospital with more severe cases. So we are likely to see the number of patients with the coming months actually going up, because currently we've understood, and that's why we are continuing to say that you don't need to stay at home when you're sick or when you have a relative who is sick for the fear of contracting COVID. In fact, you're more likely to even contract in many other places than public hospitals. So it would be good for us to go to hospital. And I'm seeing the number going up soon.
Wonderful. We get that. As we are moving on, we still have more questions. COVID is associated with cold weather. Is it now the time to be cautious? There's such a question to do with weather and COVID-19.
Truthfully, what I would say is that we've not reached a point where, and you know me, normally because I told you that I'm a research, we've not reached a point where we can say, yes, this is associated with cold weather. Because we are yet to get research findings from these. So let me still say that this is skeptically what we are still calling a rumor, but we have to be cautious all the same. I mean, Mombasa is known to be a warm weather, and yet there's a time we had a surge, really big surge of COVID-19, even more than Nairobi. So let's not take this as a gospel truth until we have research that confirms to us that this is true.
I'm reminded that there is another question. Someone's hand is up. Someone's hand is up. Maybe we can take the questions if they are there before we move on. Yes, you can go ahead. Whoever has any question to ask.
Hello.
Yes, Vincent.
I have a question, and it's about the masks. I have a mask here, and I have watched so many videos of how the mask should be worn to avoid contamination, because you see, you can have the mask and probably contaminate yourself with it. So I have seen people tying the masks, people making a knot here, and then they tie the mask on their faces. So I don't know, is it the is that the right way to be done, or should one just wear it like this? Because okay, somehow they seem to tie the knot to reduce the spaces where the virus probably get in through the sides, and also maybe your mouth. So I don't know, maybe Madam Oguna could just give us a thought on that, because I have found it a bit controversial.
One of the things is that we know that the government has given us the right mask that we are supposed to use, especially the surgical mask and the N95. Now, the N95, of course, they are left for the healthcare workers because of the percentage of their risks. But now, like the surgical mask, most of them, they come with a certain something that if you pinch your nose, it folds. And the reason why quite a number of people are folding is because quite a number of these masks that you are buying all over, they do not have the quality.
Sorry about that. I think the host, you can have the other person. The host, you can help us by purging out those intruders. The host, you can help us by purging out the intruders kindly. The Youth Barrier Breakers Africa, you can help us by purging out such intruders. Kindly, this is a learning experience. Everyone who has gotten access to our Zoom meeting has a reason why we are here. For those of us who have got no purpose being here, kindly may you allow us to continue with such a noble procession. We are here for a noble purpose, and we are here to learn so that we help our youth. So the host kindly purge out such individuals who are not with the same purpose and the same reason why we are here. I'm sorry about that. Any other person in attendance, kindly let us not be distracted from the purpose. We may proceed. Madam?
Yeah, apologies to everyone. We know that this digital space have very many challenges, and we know that Zoom has been one of the most invaded spaces in terms of these crazy people who come. So apologies for that. So what Vincent I was saying is that what we are seeing majority is that they are masks which are not quality. So at the end of the day, they really allow a lot of aerosols to come in. So in fact, even when you're wearing it, when somebody talks to you, it's easy, even if you're wearing it, okay, it's easy for it just to come in through the upper side. And so probably that's the reason why quite a number of people are trying to use the knots and just to make sure that there's no spaces in between. But ideally, most of the quality ones have a certain whatever that when you pinch like this, it makes a curve that comfortably now covers you very well.
Okay, probably on that note, before we can move to the next question, is it possible when you're talking to somebody, you wear the mask, or maybe, okay, when you're just talking, maybe singing or maybe taking a call, should you adjust the mask down, talk, and then you return it back? Because I have seen people who are doing it that, and it beats logic why they should anyway wear the mask.
Ideally, the whole reason why we are actually wearing masks is actually to avoid the transmission of the aerosols. And when you're talking, and especially either when you're singing, when you're shouting, the aerosols will spread all over. So it beats logic to actually remove the mask, talk, then you return it. Now, one of the reasons I know is that people have not yet accustomed themselves to this, what we are calling now the novel COVID-19. It has come with lots of implications, meaning that sincerely speaking, when you have a mask, there's a way it's like masks your voice. So that's the reason why quite a number of people end up now, they remove the mask and then they talk, but ideally that's not the ideal way to do it, because as you're talking, if the other person also is not covered, they are likely to actually get those aerosols. And remember, even if they are covered, while you talk to them, those aerosols jump to their masks, and then eventually they will touch those masks and touch themselves. So you see the whole aspect of now just, transmitting to each other.
That's great. Any other question, Vincent Kirungi? I hope you are satisfied now.
Okay, I have a question, but I prefer that I can ask at the end of the session. Probably the other speakers will have covered the question.
No,
very true. Here we also have Ken Auma. Ken, kindly, can you unmute and ask your question? I've seen you have another question. Ken Auma, there's another question.
Thank you. My question to our speaker, there was a research that was done in March, April, and the conclusion was that COVID can be found in the male semen. Is that still standing, or it was somebody's research?
Let me be truthful, I've not come across that kind of research, but ideally any contact would definitely cause it. And so you can imagine if this kind of aerosol and all that can cause it. But I don't want to say that truthfully that this is the truth, because I have not come across yet that kind of research. So I'm not yet aware of that.
Okay, we'll share with the host and then they'll share it with you.
Okay.
Great. I think that has been wonderful. COVID-19 being the novel it is, there are things yet to be discovered about the disease. As a nation, as a community, we are still learning, and the research is on about COVID-19. So we shall get more and more with time. Number two, I think from this point to avoid, I know there could be more questions to Madam Martha, but we are not going to wait for them to come. It is open for anybody with a question. Kindly type it there or have your hands raised. We are going to note that. But at the moment, because Madam Sarah is still with us, we are going to introduce our second speaker. That is Mr. George Tsitati. Mr. George Tsitati is an IT expert. At the moment, he is the Information and Technology Mentor, working alongside Massachusetts Institute of Technology, MIT. He is a man well-versed with information, and at the moment, we know with the health, information is power. Yes, kindly mute. Let us mute. Mr. George is here with us, Mr. George Tsitati, and that's not the only one. How can we as the youth make the COVID-19 situation to our advantage? He is the founder of Tsitati One Foundation and is a man well-versed with information that will be helpful to us. Mr. Tsitati, kindly proceed.
Wow. Thank you for the quiet introduction. It's really catching. Thank you so much. And today I'm here. I'm very happy actually. And the first thing I'd like to comment is about the guy. Hello, can you hear me clearly, guys?
Yes, we can hear you, Mr. Tsitati.
Yeah, that's nice. Actually, I'd like to comment about the behavior. The thing is that in this world, we don't reward bad behavior. And I'm actually touched with that guy. I think it was Vincent. Vincent is a good boy and he's learning, a good gentleman and he's learning. I like that. So today I'm going to talk about design thinking. So what's design thinking in your life? And we are going to take advantage of this coronavirus. It's here and we have to live by it. And by any means, we have to come with ideas, innovative ideas that will be able to solve Kenya's problem in the midst of the coronavirus. So actually, I'm using two platforms. I can't use both of them. So I'll just use one, the one I'll be presenting with. So I'll not be calling. Thank you.
Yes, Mr. Tsitati.
Okay, I'm starting sharing my screen. Mr. Maurice, so everyone can see the screen right now.
It's very visible. We can see it.
Okay.
Wonderfully presented.
Okay. So today I'm really humbled to be here, and I really like to thank the founder of the Youth Barrier Breakers Africa, Kasilo. She's doing a wonderful job. And actually, I was touched by her the moment she told me I should come and present. I didn't know her actually. It was a strange message, and today we are here, my health, my rights. So a lot of that Amanda at MIT, COVID-19, amongst others, one design in the world that is mostly the first cohort in Africa, making it 200 mentors along Africa. So I'm working to better develop designs that can be able to foster good infrastructure management, infrastructure installation, innovative, and any other design that we need in Africa. It can be in Africa, and we lose the resources that is in Africa. So we have 6 steps in innovation process. Step number 1 is what we call the emphasis. You put yourself in another person's shoes and you understand what is going through. right now, as Mother Oguna said, we are faced with a lot of difficulties, trepidation all along. And we have to understand the need of a person near you. You have to understand the need of the government. You have to understand your persona and be in their shoes and be in their position. So in design thinking, we have 6 steps innovation process. As I mentioned earlier, the first is emphasis. The second, we have the framing, the third ideation, prototype, test, and then the last one, the implementation. Emphasis, you understand the need of the person as the need is yours. You replicate yourself in that person, and you understand that this problem exists and I need to be solved. Then you have the framing. Framing, we come with a lot of ideas. You frame your thing. Ideation, actually, it comes from the word idea, is you narrow out the framing ideas that you had in the framing column into a niche that you want to solve the problem. Prototype is a model. Then test. Test is whereby you put it in the market. Is it working? No. Then the last is implementation. Allow me to start with emphasis. Empathy is a capacity to place oneself in another person's position, as I said. Your design thinking is built upon ideas that people are designing. And you know what to innovate a solution. So you understand this person. Then you go along knowing this person, building a persona, building that blueprint and the roadmap to this solution. And once you understand these persons really clearly, you go to framing. Now you see, oh, persona A has a lot of problems. Then go to framing. Framing requires 3 things: a specific user, need, insight. In the middle of Corona right now, we have a specific user. We can say we have the society. This person needs a mask. You already see the need. Then the insight. What can you do about it? And the way this ring helps, things help to organize how you think about to solve that problem. Then we go to the third thing is ideation. Ideation is the creative process of generating, developing, communicating new ideas. This process requires you to utilize the data and understanding you have gathered from the previous 2 phases to come up with a large quantity of ideas that you can then cut down into the best, most practical solution. Most practical solution. Okay, is anyone having a question up to there? Actually, I'm going a little bit faster since I'll have a prototype to show you.
No questions so far.
Yes, we can proceed, Mr. George. The questions, should they be there, we are going to have them together and they'll be asked. But so far, there's no question. Kindly proceed.
Okay, thank you so much. Thank you so much, Mr. Maurice. Then go to the prototype. As I said, prototype, you build a model. What is a model? A model is a representation of a solution. People build a model. They are, when I was a mentor at MIT, a model of a plastic mask that's being used nowadays by actually repurposing the supply chain of the PPEs in Nigeria with recyclers. So that is you build a model of plastic, then you repurpose it to the market, see if it's working. We did that and it worked. As I said, prototype is an early sample or a model of an idea or concept. Prototypes can take many forms. Some people are storyboarding in the likes of blogging. That is a best prototype in the storyboard category. To a 3D computer. Right now, my major insight is about on 3D computer generated models, the likes of doodles. Prototypes about bringing a solution to life, to explore their real world impact. What is important is that as solutions can be tested and ideas improved upon in the early stages of the development. One living, or not living actually, one of the greater leader once said, if you have a hammer as the solution, as the only solution, you will only see nails as the only problem that you'll be having. Prototype is not having to explore what is there in the market, not what is there in the market, what is not in the market. Don't see the already nails in the market, build new ones, screwdrivers, everything, build new ones, models. That's how you progress in the market. Test. Test as a word is actually a normal, a majority of us are familiar with the word test. It's actually a common word. It's an important opportunity to see how your idea works in practice. Then you gain feedback. And right now in the midst of coronavirus, I know majority of people are not moving out of the house and all that. That's now we are talking about the fourth generation, which is the technology generation. You can test your products while sitting, waiting for breakfast in your bed, using free online services, Google Forms, Doodles, as I said, Canvas. Test you right now. We are in a situation like Kenya is looked upon as a country that will become a superpower in Africa in the year by the year 2035. That's according to Swanka. Beating the likes of South Africa. Reasons being technology. So when you get your feedback, as I said earlier, it provides bigger insights and valuable experience that can inform the design process moving forward. You know what is working and what is not working. If you're using, let's say, Facebook as the only way of, let's say, a sales platform, blend in YouTube, see, is it working? No. Does this work? Yes. Blend together tools. Advantage. Majority of them are free. Then after testing a product, you go to implementation. Now in the last phase is the implementation. And this actually is the easiest. Since you already had insights and the do's and the don'ts from the test phase, implementation is just an easy thing to do. You just put your tested and prototype idea into work. Implementation is the phase where a solution is brought to life and to the market. This involves building partnerships in the real world, refining your business model, and piloting your idea to officially get it from the ground. And while keeping feedback at the center of your work to review whether your solution is working. This is the phase where you ride along with the don'ts and the do's that you have actually been learning all through. So you can allow me to show you actually a model that we built. It was supported by the Inspire Africa initiative for impact. Actually, we tried to build a model to repurpose the supply chain in the plastic industry that we can actually have biodegradable plastics in the market. So allow me to show you that. Then after that, showing that prototype, we can continue to questions, right?
Yes, Mr. George, but I would like, before you proceed to show us that,
yes,
there is a question here regarding what you have explained from Ken Uma. Ken, I'll give you an opportunity to ask your question before we move to the next step. Bwana George, if you don't mind, kindly respond to this before we move.
Okay, there's no
Ken
problem.
Auma.
Thank you so much. Good presentation there by Bwana Tsitati. My question goes like this. Immediately that COVID was pronounced as a pandemic, we realized that there was a very huge communication barrier that was brought about by it. And how can we then use technology to enhance communication so that activities can be brought closer to the people? Because now we are told to see. Did you get my question?
Yeah, I did. Okay. Thank you. That's a very great question, actually. Right now, we need to come with ideas that facilitates our community. This reminds me of a model we built in Nigeria again. There was issue of communication barriers. And we built a model whereby every local station in Nigeria could announce the issue of the effects, the negative effects of COVID-19 in their local dialect, in their local languages, be it the Yoruba, be it what. If you are situated in Lagos, you understand English, information will be transmitted via English. If you live in some places, let's say Ibadan, where English is not a majority spoken language, we designed a platform whereby Ibadan, if they were not speaking English, the language that was being spoken there or usually people speak there, that's the way information was relayed and it helped. Right now in Kenya, you can take advantage. If people are sitting in Kikuyu, don't try to air in information in English. Tell them in their local languages. As you can see, there's no majority of our local, I can't mention the local channels that forecast the COVID-19 issues, but majority of the station nowadays transmit their information, channeling the information via English, which is not reaching a lot of people. I believe I answered that question.
Thank you. And my second question, thank you.
Yes.
The government and the most private organization, immediately after COVID was announced, they chose young workers to be sent at home, and they remained with the older staff. And they don't really realize that in Africa, average age is 20 years. So, and 75% of the population is youthful. So how then do they choose to work with the older generation and not the youth who are very innovative and allows market penetration?
Thank you. First question. For you to understand this question and actually to answer this question, you need to understand the phases of every developing nation. There are three phases: the social, economic, and the political. And the economic phase of Kenya, it was really growing in a very tremendous way. And I can't comment negative on that, but and the social thing, but I'll comment and renegade on the political thing. Our government is actually not taking into consideration the innovative youths. Remember, there is a topic the Treasury was told, and he answered that Japan and Kenya have the same debt. What the treasurer, I don't know the CS or what, didn't know that Japan is an industrialized country. It can generate its own thing. So if at all we tally in our debt, as for Kenya, we don't have anything we can process. We don't have manufacturing industries. Japan has manufacturing industries, goes up to the new one, the 3Ds, everything. They can have their thing. And that's why it's really impacting the youth in our nation. That's why youth need to understand that for them to come out of this dilemma, you ought to come original with the ways that can pave ways, with solutions, technological solutions, that even if you present it to a panel, they know, oh, this guy knows what he's talking about. Youth need to be entrepreneurs. But people say, entrepreneurs, how can I start entrepreneurship when actually I have a zero amount of money in my account? With technology, as far as you are connected, you can start a venture with zero cash. A lot of platforms are giving away seeding money. To answer that, actually, I actually can't comment on why the government is choosing the older people, despite younger people being innovative, being, let's say, leading technological frameworks. No, I can't comment on that about why the government is doing that, but youth need to come out with solutions, since we've already been mirrored by our government that it's the older that matters. Thank you.
Wonderful. I think it is very clear to the youth that we need to be innovative and move on from that point. Thank you so much. Then we can move forward. Mr. George, you can move forward kindly.
Okay, allow me to share my prototype.
Yes, as that one is going on, I think Mr. George is sharing a prototype. And for that reason, I think we are moving on well. It is my request that all of us remain muted so that we get everything as we move forward. It is getting wonderful and we are learning. Not only you, but even we people on these other sides are learning one or two things to take home. Mr. George, are you ready?
Just a minute.
It's all right. Good. As that one is happening, one thing that is getting common there about innovation, people or the youth, there we are. Mr. George, kindly proceed.
Okay, thank you, thank you. Just a minute.
Can you just organize yourself and get ready? Meanwhile, I can share this one with the people. I remember during the time we have Euripides at one point said that youth is the best time to be rich and the best time to be poor. Hopefully, we can relate that. Youth is the best time to be rich and it is the best time to be poor. In regard to that, with Mr. George Tsitati, I think we are getting the point and we are moving on well. Otherwise, ladies and gentlemen, any other question you have them posted. Do not shy away because that is the reason we are here. We have experts to respond to your questions regarding COVID-19, health cause, and the innovative aspect of it. What can we do as the youth, as an individual? What is your responsibility? What role do you hold as an African youth at this time of the moment when we have the ravaging effects of COVID-19? That one is a question, a challenge that we have to put for all of us. Now, I've seen cases of people asking for slides. It has to be noted that at the end of this one, we are going to get all the slides. We are going to get all the information, but there is a question by Vincent. Vincent, can you ask before we go to Mr. Tsitati?
So, let me begin by saying thank you to Mr. Tsitati for the compliment he made earlier. And to my question will go to Madam Oguna if she's still with us in the meeting. And I don't know if she can, I don't know if I'm live on the meeting, because I also want to ask another question concerning the face masks and the face shields. At the beginning of the pandemic, the government was urging Kenyans not to use the face mask. And later on, after some research was done, it was discovered that the face mask will help reduce the cases of COVID spreading in the country. So before that decision was made, some audios spreading on social media, the audios were suggesting that the masks should not be worn. The reason how people wear the masks, because it could lead to self-infection. So I don't know if really wearing the face mask and the face shield, it will be efficient to help reduce the disease. I have no information, I have no statistics to prove that there have been cases that have arisen because of wearing the face mask. Probably a wrong technique, but it's just my desire to know. Probably Madam Oguna can give a take about the face mask and the face shields and how efficient really they are practically. And also maybe she can demonstrate how we wear face masks, because there's just a lot of information. And I think this is the right time to just clear the air about the face mask and the face shields.
Thank you, Vincent. I've heard your question. I've noted it down. What maybe I would like George is to just continue, he finishes, then I can answer your question, if that's okay with you.
I think that's fine,
Yeah.
Very well, George is ready.
Okay.
There we are. I know Mr. George is going to explain the figures and the pictures and the slides.
Okay, thank you. That's one of a prototype that we pitched. Actually, we pitched virtually, and we were number 3 in Africa. And you can see is a prototype that showcased actually about the problem that is there, what the solution is, and we had a model of that bioremediation. Okay, if anyone has a question, feel free to ask, and I've seen people asking for the slides. I'll share a slide with our moderator, Maurice, and Ms. Katile, that's the founder. And anyone else who need a copy, I'll actually share with you my email. And okay, thank you. Any question, feel free to ask.
Yes, any question? Any question to Mr. Tsitati? Any question to George? Do you have anybody? Remember, we are here for all those questions. The experts are here for us, and we have to leave no stone unturned.
Can I the question?
Continue.
Thank you very much, Bwana Tsitati. The biggest challenge with innovative ideas is not the problem of execution, but financing. How then, as
Hello, pardon, actually, your voice was cutting. It was a bit blurry at the end of your question. Can you actually, pardon, and repeat the question, please?
Yes, thank you. Let me repeat. Somebody was calling me. Now, my question is, our young people are very innovative and they have full of ideas, but the main challenge is financing or seed capital on how to proceed. And mostly, I'll again go to government. They only give money not for innovation, but for manual work. So how do we encourage our young people and where they can find seed capital for the innovations?
Actually, thank you for that question. I know for you to finance your business career is really hard. There's no the financial assistance, and all companies that lend, they always give up pickups. So on question on financing, there are a lot of online and virtually available platforms that actually You can register. Majority of them are free. Share your idea with them, and it depends on the terms that you will have with them. Maybe you can share of the company. Maybe they will have shares, but at the end of the day, you'll have the seed company, the seed fund to start your organization. And actually, you can also do bootstrapping. Bootstrapping actually you see what you have. The picture that there was a picture that was circulating in the media. There was a guy who innovated a chair. At the end of it, it was a table. I don't know if you've seen that. The guy who a chair at the same time, chairs, then a table, and all that. He bootstrapped. He used the material that he had. And the other thing you can do, crowdfunding. You can do anything. I'll share actually. Whoever asked that question, I have a slide about it. Contains all those online sources that you can start your company. You can go and mirror your ideas to them, and they can finance your idea. I'll share with you. Actually, reach out to me. I've pasted my email down there, and I'll share with you the slides contain all that. Thank you.
Wonderful, that's great. Mr. George's email, Madam Martha's email account, all there in our chat box. You will get that. And there is a communication that if in case you register for the meeting, then automatically you will get the slides. And if you didn't register, then you can do the same. And the email account, asmilefortheyouth.africa@gmail.com is there for you to do that. So in the end of it, all that will be shared by both of our speakers. You will get all that. Now, I think as we are moving forward, then the question that was asked and directed to Madam Martha can now be responded to as we wait for more questions to Mr. George Tsitati. Kindly, Madam Martha, it's now your time.
Thank you, Maurice. Vincent, I think, is the one who asked about the face mask and shield and the research that had shown. Now, initially, I think I had explained I had explained the reason why we call it novel. Now, novel means it's something new that takes time to actually know how it really, presents itself. One of the characteristics of viruses is that they mutate and they change. So we do not know how they will change in time. And so for now, we know that protecting ourselves through masks and washing hands is the way forward. And this goes by even talking about the flu, just the common flu. These are actually one of the major ways that it's actually transmitted. And so we actually have to know that this will definitely take time before we know the exact way forward. I want to return you guys back from the days of HIV. I don't know how many of us guys were there when HIV had the greatest stigma in the world, such that even burial sites, even the way a body was handled, even the way just a patient of HIV was handled, was in a way that I don't want even to explain. It was just some grossly way to look at it. But eventually we came to learn to live with the virus. So eventually we will come to learn to live either with the virus or it will, go away by its own, which is quite unlikely, but somehow we will know how to live with it. So anything novel at any given time is such that things come new every day. In fact, there's somebody who even asked about has semen been found to transmit COVID-19? There's different studies that have shown it does not. Yet there are still studies which show that it does. But it takes time to actually research to say that, yes, we have confirmed that actually this is the way forward. So meanwhile, the best thing we can do is that let's take all precautions that are available. Let's wear the right masks. Especially whenever you're in public, I urge you, kindly just put on your mask and avoid touching your mask and then eventually just removing it and touching yourself. In fact, most of the time it will be doing nothing for you. You know, like for example, the way I'm seeing people wearing masks, you know, you wear a mask, you touch yourself, then eventually you don't wash your hands, you remove, you put at the chin here, then eventually we actually see you, you know, touching yourself. That does not give you any protection. So we have to be very, very careful in the way we do it. I think shields was just part of like just face mask, and especially like many people that I saw doing these shields are people either in airports or supermarkets and all these kind of places. They still play the same kind of role. But if we, bottom line, if we don't take care of ourselves, in especially making sure that we do not touch our faces before washing our hands, and trying as much as possible, treating that mask as something that is easily contaminated, we will have a lot of problems eventually if we don't take care of these things. I don't know whether Vincent have answered you to that point.
Okay, you've answered, but there's a small bit which you haven't concerning the, I don't know if you're in a position to demonstrate how our face mask should be worn, or probably it can be, you can just send some information later on. I don't know, maybe you
can you give me just 1 minute? I asked my son just to bring my mask.
Okay, no problem.
So this is my face mask, sawa, and I use the surgical face mask. So I wear it to my ears. I usually don't even bother making those knots. Then I put it here, yeah, because it has something here that I told you that you can pinch. It makes a certain shape. We can all see that it has made that shape. So it fully covers myself properly, you know? So at least nothing is able to enter from all over. It has covered me fully. And if you notice that we always have to wear the place that it has this thing that we can pinch through so that it makes this. And in fact, it gives you room, that you have room even to talk, room to breathe. So that's the best thing about the face mask. So the many face masks that we are seeing currently, especially the cloth one, they may have very little. The only advantage with the cloth mask is that they are washable. But other than that, they really do not give us the right protection that we need.
Okay. And maybe to add something to Vincent.
Yes, please.
There's something specific with Madam Oguna's mask, the type of mask. You can press using your hands by the sides to your chin, and the mask will stick to your skin. So it will have no space for the virus to penetrate through if you are in a high-risk room or environment. If you know you're in a high-risk environment, you use a surgical mask and you flatten the sides with your hand. So there'll be no gap for any virus to penetrate through. So those people using the mask below their nose are not helping themselves. And those people putting the mask below the chin are not helping anyone, not even the media or PR. So they rather not use it at all than put it below the nose or below the chin. it is only infecting the chin more because the skin under the chin is so light that viruses can penetrate very easily. By the end of the day, you'll see them having several infections under the skin, and they don't know it is them who brought it about themselves. Thank you.
In fact, one of the things that I came to realize that how this can be so effective, and especially, I don't know how many of you wear specs. Specs can be very, very limiting when it comes to wearing masks. I realize when I wear my mask and I wear it properly and I pinch it here, it closes the gap such that there's no whatever that goes into, you know, the way our specs are easily, they have mist when we are talking and when we are breathing. When you actually put it properly, I realize that actually those mists don't actually occur. So this is one of the things to actually know that you're wearing it properly. Yeah, so I hope that really has answered your question.
Yeah, it was well answered. And okay, I had noted down some few questions. So maybe my last question to you, Madam Oguna.
Yes.
Okay, there are countries like Italy, Germany, and some of the Western countries have had cases of a second wave. And as per the trend right now, the curve is flattening. So my question is this: is it that a second wave will have to be a part of a country's norm to overcome the disease, or is a second wave occurring maybe due to a few, let's call them a few mistakes being made here and there? Okay, let's talk about our country, Kenya, because the way the curve is flattening. So I don't know, a second wave part of the normal trends in overcoming this disease, or is it something that is just another occurrence? I don't know, probably could talk about that.
I think initially I had mentioned that viruses have a tendency of mutating. That's their characteristic. And so many times whenever we actually, what we call kulegeza kamba, in terms of we just now are not cautious about it, we are likely to have a big surge about it. And one of the things is that we have to note that by the time we were having this virus from China, of course it had also mutated to some level, although even the mutations mostly are more or less like the original. But one of the things is that it's very likely for us to have another surge, but now depending on how it will go. There are very many situations that we can't compare ourselves. Like, for example, in Italy, one of the things is that their testing capacity is at a very high level. So the more they tested, the more they had the statistics. The less we have to test, the less we'll have the statistics. So we have to remember that these are countries that have high level of testing, and that's why you will find that their statistics will be way higher than ourselves, especially in Kenya and any low-income country, because our testing level, I mean, as of now, if we've done just 35,000, you can imagine how much more we have to go for the 42 million. And then they really had a better testing capacity than we do. So that one, those are some of the things that we have to agree with, that we are not the same. And remember, in those countries, by the way, even just a normal flu is one of the highest and leading causes of death, just a normal flu. So these are some of the things that predisposes those kind of countries to this kind of viruses.
Well answered. Thank you very much.
Thank you, Vincent.
You're welcome.
Wonderful, wonderful. Kindly proceed. There's another question. Yes, Abubakar.
Yeah. Okay. I am Abubakar Al-Hassan Bichi. I'm speaking from Nigeria. I'm a medical social worker by profession. and I'm the National President Association of Medical Social Workers in Nigeria. My question goes, you know, some people put the face mask this way, the color is looking outside, and some people put the face mask this way, the color is looking inside. So what's the rationale of doing that? Is there any point of putting it the other way or the other way? Mr. Oguna, what can you say about that, please? Thank you.
If you have decided to put it in one way, you should maintain that face mask as it is until the time you dispose it. And one of the things we have to note, especially with the surgical face masks, they are disposable. So it means that you cannot stay with this kind of mask for a long time. Within a specific time, you know, it's only that you don't have, but within a day, actually, you should be able to dispose. And that's why quite a number of our government agencies have really subsidized in terms of acquiring these face masks. But the moment you, like, for example, what I have in front of me, once you put it this way, I think already even the strings show you this is the outer side of doing it rather than the inner side of doing it. Inner side, you can see there's nothing. So already this explains to you how you're supposed to put your face mask, that the more whiter side should be on the inside than the more colored one. I am not so sure, Abubakar, how your face mask look like in your country, but I'm so sure that it could be more or less the same with what we have. So ideally, the inner part should be the more white one and the blue one should be on the outer one. So this white one should be actually inside. And you have to make sure that when you wear these, ideally it's supposed to, once you go to the public for a whole day, you're supposed to dispose it. I've seen even people washing this. Once you wash it, I'm telling you, it's not efficient anymore.
Okay, of course, I do wear my own, the way you demonstrated. But maybe the theory people are fastened that when you wear it and the whiter color is looking outside, that means if you are not infected. But if you are infected, you will wear it, the color, the blue side or the color side is looking outside. But for me, I do wear it as you just explained. I'm just trying to know this hypothesis or this theory, why it come about. You know, Africans, they have a lot of this. So that's just my...
I think those are theories, as you call them.
Actually, let me contribute the same to Abubakar's question.
Yeah.
Yeah.
Mr. Abubakar, what Martha says is true. And the mask has what we call a 3-ply. It has got 3 elements in it. So the inner white part helps you to protect the virus from reaching your nose.
Yes.
So if you put on the mask with the white part inside and you blow, no air will pass out. If it does, then it is a fake one.
Yes.
And the way it was designed,
What it is original one, what it is original one, and you put it this way, when you rekindle matches, you can't blow the matches like this. Let's say you have a matches, you kindle, you blow, it cannot kill the lights. That's the original one, right? Is that what you are saying?
Yes.
Okay.
And the outer part is designed also for the environment.
Okay.
So if you do it the other way around, you're going to attract more other components in the air onto your mask.
Yeah.
That's why we have the inside and the outside of any element that you're working with. There's the inner part and the outer part.
Yeah. So for me, I'm with her because I attended so many COVID-19 training, being a medical, hospital-based social worker. But I just brought the question to the benefit of others. Thank you very much.
Thank you so much, Mr. Abubakar.
Madam Martha, there is also another question that it is said tobacco smokers are at high risk of getting COVID-19. What's your take on that? I see someone has posted that. You can.
Yes, this is true that tobacco smokers are at high risk of getting COVID-19. We have to note that this is a respiratory issue. And so you can imagine already if your lungs are infected, already the COVID-19, by the time it's getting into you and finds that your lungs are already compromised, this will not work out well. And so, yes, tobacco smokers are at high risk of getting COVID-19. No, actually not, let me say not even getting COVID-19, actually even just having the complications, higher complications and leading to death of COVID-19.
Yes, we have another hand up, Vincent Kiriungi.
Okay, I'm back again. And now my question is about community. There is community, or what you can talk about, herd immunity. Probably, maybe Madam Oguna can just explain a little bit about it, because in your presentation, Madam Oguna, you presented and the statement that was saying that it will affect mostly the elderly and those with underlying conditions. So I don't know, how will it go with them, with the herd immunity? Because it's as you said, it's a virus that mutates, and I believe it has also mutated as it was within our country. And could there be a mild form of it so that it cannot affect some of these people who are more vulnerable to the negative effects of COVID? I don't know what your take on that.
Truthfully, by the herd immunity takes time before we actually realize that we have herd immunity. And I say that this takes time because this needs some form of research. Because we need to now start testing for antibodies. What I mean is that antibodies is where we test now whether you've ever contracted COVID-19. But now we've not yet really reached that point in time. And so we are still trying to put things into place to still really understand the whole thing about COVID-19. So we are still yet there to say that we have herd immunity.
Wonderful. We have another concern, Madam Oguna. A question is posted here. Some sanitizers have side effects. Which sanitizers can you advise us to use? Someone is asking that.
One of the things is that I think people react to things differently. So one of the things is just to make sure that if possible, just try to get something that you can get from either the pharmacy or from the hospital. Alternatively, with the use of it with time, you'll get to know what really you're allergic to, because I know many people get allergies differently, even with things that obviously don't affect quite a number of people.
Wonderful. Madam, another question. I think someone could be asking this one. COVID-19 is entirely a respiratory disease. And out of the underlying cases, you talked of those people with diabetes and others. I didn't see a case of an asthmatic person. So why is it that those who are diabetic are likely to bend or succumb to the disease at a higher rate than those people who are asthmatic?
One of the things with diabetes is already it has compromised your immunity. And even asthma, yes, but I wouldn't say to a biggest, what can I say? Yani to a larger proportion. And this is because many asthmatics, if there are known asthmatics, they already have a regime that you're using too. But already a diabetes, a heart disease person, a renal person, this is already people with compromised immunity in terms of these are chronic illnesses with already they're using medication. So that could be the reason why.
We get it. And we have another hand up here. Ken Auma has raised the hand. Ken, any question?
Yes, I have one question here. WHO and the Bill Gates Foundation very sure that Africa people will die in millions. What went wrong that they didn't die?
As I said, we really have so much research to do about that. So keep tuned. We are still doing the research, because as per now, I really can't say. We have so many things that have predisposed. Like, for example, it's so obvious that many times me and you, if we get flu, we'll still go to work. But many times when people in those countries, when they get flu, they die in large numbers. So we are either predisposed to some of these many cases, but we are yet to actually conclusively say that this is it.
Wonderful. There could be more questions, but due to the time limitation, we can't proceed beyond that. I know the questions can't be exhausted, but our speakers have given us their contacts. Madam Oguna has given the email account. Any other question? This is not the end. Our members can proceed. You can always ask questions directly or whatever case it is. Then, as we come to this point, I'll give our speakers time, each of them 2 minutes at least, to give us the parting shot from this point. We'll start with Mr. George Tsitati, and then Madam Oguna will conclude. Mr. George, I know there are questions, but kindly we'll have to post the questions so that we proceed.
Okay, it's really an amazing and wonderful time to be with you guys. And my co-speaker, actually, I can say it's really a great honor to be with you today. Thank you, Martha. Actually, you are the one who pushed me to, I didn't know about slides presentation. Actually, I could have come here just check, but thank you so much. Thank you. And another thing, I'd like to give a shout out to Ms. Katilo, I think. You are doing an amazing job, and I'll share with you the seeding platform. I'll share with you any notes. Right now, I'm a Sabi Fellowship, whereby we have a virtual thing. I'll share with you my notes, and I hope it will bring change in your life and everything that you desire. And thank you again, Maurice. Thank you for your time, and thank you again. And for the participant, thank you again. Kindly reach at me. I've given my email out. Tukipatana huku nje, vaa mask vizuri. Mungu awabariki.
Yes, Madam Martha. Wonderful, Mr. Tsitati. Madam Martha.
Just before I give any thanks, I just want to say that we have to know as young people that COVID is real. You may not know 1 or 2, 3 people who has it, but I can assure you that it is very real. Put on your mask, sanitize, wash your hands. Just know that you're the leading carrier of COVID-19, and you're likely to actually transmit it to the older people. Kindly let's take care of this category of people. Just as my co-speaker said, I want to say thank you so much for this opportunity. Thank you so much, Ms. Katilo. Thank you, Maurice. Thank you, George. Thank you, all the people who've attended today. It was an honor to be here, to answer your questions, to present to you, and looking forward to more of these opportunities. Thank you so much.
Wonderful. We are happy, and happiness is the highest form of health. For my case, as Maurice, I want to believe that I've learned. If you have not learned as an individual, then for me as an individual, I do carry something very important. I'm learning something new regarding this. Now, to Madam Martha and Mr. George, it has been great. I want to thank you and all the organizers. Now, to all the members who are here, to the youth, for me, I will leave you with the words of Neville Ravikant, that doctors won't make you healthy, nutritionists won't make you slim, teachers will not make you smart, And gurus will not make you calm. Mentors will never make you rich, and even trainers will never make you fit. Ultimately, you have to take responsibility. Save yourself. Wonderful. I am happy. Up to this very moment, I'm going to welcome Madam Gift Ngina, to end this session after telling us something from the Youth Barrier Breakers Africa. Gift.
Okay, thank you, this moderator. The session was good. I could start the video. No. Okay, I hope you can all see me.
Yes.
Thank you.
Yes, we can.
Okay, thank you for the speakers of today. At least you have known what COVID-19, what it really is. I thank you for those who have participated all through the session since day one until today, as is our last day, so you're closing the session. I hope we'll meet on other talks as we learn more. So as Youth Barrier Breakers, we appreciate you so much for your participation, your volunteering, of being part of us. So let's just end the session by thanking all of you. See you in our next session. Our team is so grateful, and we thank God that He has seen us through the whole session since day one till today. We'll plan other sessions and we'll let you know in our social media platforms. You can follow us, Youth Barrier Breakers, in Facebook and in Instagram. And you can find our numbers there. You can communicate through the email. It's available there. So thank you all, and see you in our next event. I appreciate you all. Have a lovely night.
Thank you, Gift.
You're welcome.
Lovely night to you.
You're free to leave.
Don't get too cocky. There's always another lesson to learn. Mr. Miyagi saying? Nah.